It's the weekend. Be good to yourself. It's Katz's Corner with Dr. Aaron Katz and Dr. Philippa Cheatham, where you can get simple, straightforward answers to your questions about health, from diet and supplements to lifestyle changes. To reach Dr. Katz and Dr. Cheatham, call 800-848-WABC. Now, live on 77 WABC, the chairman of urology at Winthrop University Hospital in New York, with co-host Philippa Cheatham, attending in urology at Winthrop University Hospital. Here is Dr. Aaron Katz.
Good morning, everyone. Welcome again to another live round of Katz's Corner here on WABC Radio in New York. I'm your host, Dr. Aaron Katz, and I'm here live at 1-800-848-WABC. It's 1-800-848-9222. Dr. Cheatham is away. She's visiting her family at home in London. I'm here alone, so if you'd like to give me a call on this, what's going to turn out to be a nice Memorial Day tomorrow and today, I'm glad to be here. And, fun thing, I wanted to remind everyone about our prostate health seminar. So you can register at menshealthseminar.com. That's menshealthseminar.com. I hope to see you all there. We have a number of people that have already registered. We're well over, we're close to 200 people now. So we hope that we'll see more of you on June 15th. That's at the Garden City Hotel. And I'll be there, Dr. Cheatham. We have a number of wonderful speakers that will talk to you about the latest and greatest in men's health, health under the belt and above the belt. We'll talk about cardiac health, bone health, sleep health, sexual health, prostate health, of course. And I know it's going to be a wonderful day, and I look forward to seeing all of you out there. So many of my patients have told me that they've signed up year after year. We've been running this. When I was at Columbia, we ran this program, and now I've taken on the position of chair of urology at Winthrop, and we ran it last year. We had close to 200 people, and this year we'll probably have more. So you do need to sign up, just a few weeks away at menshealthseminar.com. Again, if you'd like to call me, it's 1-800-848-WABC, 1-800-848-9222. I didn't have too much to talk about today, although there was a topic that has come up recently that I find very timely. I also find important, and some of it a little bit annoying, frankly. And that is the whole topic of testosterone replacement. And so many of the companies that have come about, even those that advertise here on WABC, natural testosterone replacement companies that have spurted up, trying to tell men that they need to get this natural product to help them in the bedroom, give them firmer erections, help their libido. And there's no scientific evidence that any of these products are going to be helpful. There's no scientific data. There's no clinical trials. There's a bunch of anecdotal nonsense on the internet and people that prescribe these things and tell other men to take them. Young men, testosterone to young men, just because maybe they have low energy, low sex drive. Who knows what's going on with these people? Who knows what's going on with these men? Maybe there's other emotional factors that's going on. Maybe they're on other medications. Maybe it's not testosterone. You just can't give testosterone supplements to men and think that that's going to be the be-all, end-all, the one pill that's going to help them. And let me tell you something. I mean, you give a young guy or even an old man testosterone, it can have serious side effects, and it can cause infertility. It can cause your testicles to shrink. It can cause cardiac problems. And, I was just listening to one of the advertisers on this station say, oh, well, you don't want to go to the doctor and have those embarrassing moments. That's nonsense. You do want to go to the doctor, especially if you're having, sexual issues. And you need to have a testosterone level checked, and maybe it's not testosterone. And time again, I see these companies and hear them, and I'm sure you all do too. To call right now, and it's guaranteed, and you'll take this and this one pill, and it's going to help you. And I'm just tired of it. I think it's wrong. I wish that the government would step in and ban these companies and take them off the market, because I think that I think people will look back on this and say, wow, what were we doing to guys? What were we trying to do here? This is this is really going to cause, this has caused a lot of problems. And the thought that, you could take this one pill. And even, I don't know if you've seen just today, New York Times Magazine, front page of the New York Magazine is this woman who looks like she's going to strangle herself. Unexcited is the title. Unexcited, because she's because she has no sexual, the libido is gone. And again, these companies are sprouting up trying to enhance women's libido by the female Viagra pill. Look what Viagra's done. It's exploded. But, some of the men that are older that have an organic or a real cause for having a problem with their erection, maybe it is testosterone that's reduction. Maybe it's blood flow. Maybe it's because their cholesterol levels are too high. They're overweight. They're eating poorly. They're not exercising. So they're looking for the one pill. And the one pill could be Viagra. And Viagra has helped a lot of men, especially men who have had surgery, to help them recover from surgery. But it's under the advice, it's under the supervision of a urologist, of a physician that is trained. It's not just call this 1-800 number and get this testosterone booster and don't go to the doctor. You don't need to do that. And you don't need those embarrassing visits. And we don't even know if your testosterone is low. God, it really upsets me. And, I don't know. If you have any questions or any thoughts about that, let me hear what you have to say. Are you upset about it as I am? At 1-800-848-9222. It's not the one pill. And the whole thing about anti-aging, I think that we need to change our expectations just a little bit when we get a little bit older. I'm not saying don't have a great sex life or don't enjoy your life or have wonderful pleasures in your life, of course. But it's not just about finding that one pill that's going to change everything. That's not the answer. That is not the way to go. Well, all right, we have a few phone calls. But if you have any thoughts about that, about anti-aging or these testosterone replacement companies or supplements in that regard, give me a call at 1-800-848-9222. Because, I do see men every day, and some of the men tell me that, yes, they can't get out of bed. They need the testosterone. Now, we do the testosterone, and it's 100. I mean, normal is, let's say, 400 to 600. And if it's 100 and it's very low, do I use the pharmaceutical-grade testosterone replacement for men that need it? Yeah, I do. And does it help? Yeah, it does. Many times it does, if it's the right indication. But to just go out there and to have these companies and saying that you should be taking testosterone without knowing what the levels are, especially to give it to, let's say you're 26 years old and you're going through some depression and you think it's low testosterone, this can affect your testicles. Because when you take testosterone, what it could do is it could prevent your own testicles from making testosterone, and it may shut down your testicles, and your testicles could get smaller. It could cause infertility. Awful, 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 awful. All right, well, let's hear from you. If you have a question at 1-800-848-9222, I'd love to hear your thoughts about this. Meanwhile, we'll hear from Ralph in Queens, who has a question. Good morning, Ralph. How are you?
Good morning. Thank you for taking my call.
No problem.
A while back, I was at the doctor, and I was diagnosed with a vitamin D deficiency. So I was taking the vitamin D religiously, and everything. What exactly does it do for you? Does it help absorb calcium? Because I recently had a what do you call it, stone, kidney stone.
Right.
Which I passed about almost 2 months ago. Now, that wouldn't taking vitamin D wouldn't contribute to...
unless you're taking too much vitamin D, Ralph.
I wasn't taking one a day, 400 units.
400 units a day, Ralph, is going to do nothing to your vitamin D level, period. I mean, it's not going to boost your level. It's going to maintain probably what you already have, which is a low level. Have you checked your level? Have you got a blood test?
Not lately. The last blood test I had was in the emergency ward 2 months ago when I had this kidney stone.
Oh, no, they're not going to do a vitamin D level in an emergency
ward.
Okay, so, now that you've passed the stone... And I'm sorry Dr. Cheatham's here because she's a stone expert. But, from what I, know of stone disease, first of all, one calcium stone does not require a full metabolic evaluation because it could have been sporadic, could have been due to stress, dehydration, maybe it was a warm day out, maybe you're on other medications that could cause just one stone. But if you're concerned, you should get a calcium level, you should get a vitamin D level, and you should also probably do a urine test, a 24-hour urine collection, which can be done. But most doctors would say, and I would probably agree, one stone, you probably don't need the full metabolic evaluation. But you got to make sure that you don't have other stones. Even though you passed one, I would probably recommend you get a sonogram, an ultrasound of your kidney, and make sure that you don't have any other stones up there.
Well, I've been watching my diet because they say stay away from dairy products, milk, cheeses, and stuff like that. This is true, no?
Well, it's true if you have a high calcium level or high calcium in your urine. It's true, Mm-hmm. But if you just had one stone and you passed it,
yes.
I don't know if that's necessarily true for you.
Well, the thing is, my older brother, he had a bouts with kidney stones. So now I'm thinking maybe it runs in the family. I don't know what to think.
It might, Ralph. It might, and it might require you to have a baseline calcium level, vitamin D level, and a 24-hour urine collection to see the minerals that are in your urine. And if, diet would change. I would stay on a normal diet, and then I would get the urine and then see what it is. Don't change your diet. Just stay on what you normally like to eat. Obviously, we want you to eat healthy, and,
right.
I think in terms of, we talk about prostate cancer on this show, dairy has been shown to be something that you want to stay away with for the prostate. But for you, for kidney stones, I would stay on a regular diet to get a 24-hour urine and a vitamin D and calcium. Okay,
Just
Ralph?
to get back to the vitamin D, it does help absorb calcium? Is that what it is?
It can help, and also can help in other ways as well. So
right.
I would get a vitamin D level, and then let us know.
Thank you very much.
Hey, have a great weekend, Ralph. Jim, good morning. How are you?
Oh, good. Thanks, doctor. Probably 12 years ago, I was diagnosed with Peyronie's disease.
Okay, so Peyronie's disease is a condition where the penis curves when you have an erection. So when you have an erection, you like to go straight. When you have a plaque, or you may have had an injury to the penis, could be something that was caused during sex. Actually, there could have been a little trauma to the penis, and a plaque, actually a calcium plaque, forms on the top of the penis and can cause the penis to curve right or left or up or down. In some severe cases, it can actually cause men to have poor erections, poor quality erections. It can interfere with the ability of the penis to expand when blood is required. So is that what you have?
Happened to me.
That's what happened to you. Okay.
Yeah.
Well, there are a number of. So are you asking about treatment for that, or?
Well, I did. An injectable needle.
Yeah, okay, so there are a number of different ways to get rid of the lesion. I mean, into the lesion, into the plaque itself, or into the penis to give you an erection?
Precisely.
To give you an erection, like a papaverine or something to stimulate blood flow.
Exactly.
And how did that work out?
It worked out quite well, as a matter of fact. I was just wondering if there's anything that can reverse or cure Peyronie's.
Oh, absolutely. I mean, one of the things that you could try, and it may not work, but something to give, there is data to suggest that vitamin E and a herbal compound called potaba. I'm not sure of the recent data on that, but, there are other ways of getting at the lesion itself, injecting collagenase or other agents into that. We do have a doctor actually at Winthrop that does that. His name is Dr. Brett Mellinger, and he does see a lot of men with Peyronie's who can inject the lesion. There are times where the plaque or the lesion is causing a severe deformity of the penis, and it has to be surgically removed. And sometimes, if the erection isn't good, you may have to have an implant placed. But
that's no longer the case. It's
right.
That didn't. There's no more bend, but it's not. It's just not as good as it used to be.
Yeah. How old are you?
It's sort of shrunk. 71.
71. Yeah. But you are doing the injection program. Is that right?
I did it a few years ago.
Oh, and you don't do it anymore?
No, I just didn't. No, I stopped going to that urologist. And I use you now. You're my urologist now, but I haven't. but I just haven't. It hasn't been a big factor, but now it's becoming one.
I see. Well,
and I'll probably come to visit you this year, although I'm in good shape still.
Yeah, well, I'd love to see you, Jim. But, in my practice, I basically refer the guys to someone in our group that I feel has an expertise in erectile dysfunction. I mean, if somebody needs Viagra, I can prescribe that, or Cialis. But if it requires the next level where you need injections, then I do refer them over to Dr. Brett Mellinger, who can go through that with you. And if that's no longer working for you, or you don't want to do the injection, some guys go, "What, are you kidding? I'm going to put a needle in the penis?"
No,
It works well.
That was doable.
It is.
I think it's I think it's excellent.
Yeah, it is. It does work very well. I mean, we have a lot of diabetics that do it, a lot of men that do it, and you go into the bathroom and you put this needle in, which does have a pharmaceutical in it, but it does deliver a lot of blood into the penis very quickly. It's well studied scientifically. There's thousands of articles on it, and for the most part, it works. But if guys, they get tired of it, then if you wanted to, take the next level, then you would talk to Dr. Mellinger about an implant. I don't know if that would be something you'd be, interested in, but that would be something that.
No, I don't think. I think the needle's the answer. But what I'll do is I'll make an appointment with you, see you for a general urological checkout, and then see Dr. Mellinger.
Yeah, I think that would be. A good idea. How about your desire at 71? I don't know if you heard a little bit of a rant that I was doing earlier, but
no, there's no problem with desire.
Good. And you're in good shape. You take care of yourself. You're eating well.
Absolutely, yeah, perfect. Everything's great.
Well, good for you.
The reason I haven't seen you in 2 years is because when I get my physical, I still get the PSA, and the PSA is going down. It's like 1.8.
Excellent. Well, are you on some of the nutritional things that I recommend? Are you doing that?
I take about 50 different nutritional supplements a day.
50? 50? 50.
Well, that includes, of course, not just vitamins, but the lipoic acid, other things.
Okay, a lot of anti-inflammatories and things like
Everything.
that, and that'll help your PSA. And I'm glad to hear that. Well, I'm glad to hear from you, Jim.
Vegan diet, exercise, yoga, the whole thing.
Absolutely, the whole program.
The only thing is the Peronis really knocked me for a loop, but I probably deserved it. So what can I say?
Deserved it? Why would you say that?
Too much activity.
Oh, I see. Well, no, I don't think you deserved it. I mean, if you had
Karma.
to,
we live by our choices.
Well, that's true. That's true. All right, very good. Thanks for your phone call, Jim. Always good to hear from you, and I hope to see you in the office. Yeah, I mean, not that you're going to have too much sex, you can develop a curvature of the penis. No. But traumatic sex, or if there's a bend in the penis, and that can cause some trauma. And the next thing you know, you do have this buildup of a plaque, they call it, a lesion, if you will, a calcium deposit, which can cause curvature, can cause some pain sometimes, and that's called Peyronie's. And there are a number of different treatment options, but believe it or not, one of the treatment options for it is vitamin E, which, if it's a very small plaque, it can be helpful. 1-800-848-WABC. Just a few more minutes here in the studio at 7:21 on this Memorial Day Sunday. I know that Mary is on the line. Good morning, Mary. How can I help you?
Oh, good morning, Dr. Katz. Sorry to bother you. But listen, my father's...
No bother. Yeah, I'm here.
My father's 92 years old, and I went and had his PSA done. And in April of 2011, it was 1.86. And then when I just had it done in April of 2013, it went up to 5.86. The only thing I'm concerned, I used to give him this herbal prostate combination of saw palmetto, stinging nettle, and pignotinus, and I stopped it once it went down, once I got it to the 1.86. So I want to know, I'm going to start giving him that again, but I want to know, when should I go take the PSA again?
Never. Okay?
Never?
No, never. Mary, your father is 92, did you say?
Yes.
Okay. God bless him. He's 92. Let him live his life. Okay, he doesn't need to go in and be worried about a PSA test at 92. I'm sorry. I mean, and thanks for your phone call. But at 92 years old, if he has a PSA of 5.8, I don't think that he needs to have another one. Okay.
Okay. Now, should I still give him that combination because he's been going to the bathroom like 2 times?
He should be seen if he has urinary problems at 92, which is not uncommon. Then he probably should come and see a urologist, okay, near your area, because he's 92. You don't have to schlep him. I don't know where do you live? In Manhattan? You live?
In Manhattan.
All right.
Yeah.
Well, there's great urologists in Manhattan. There's many of them. He probably should see a urologist just to make sure that he's emptying his bladder, because the bladder can get weak. Bladder's a muscle, 92, and muscles get weak. So you want to make sure that he is not retaining too much urine, which could affect his bladder, could affect his kidneys. But he doesn't need any more PSAs, Mary. Okay, let's.
We'll finish.
No, it's
okay.
done.
So and I don't need to give him that medicine, the prostate, the thing in that.
You could if you think it's helping him, but again, I think he deserves probably a trip to the urologist. Okay.
Okay, thank you so much.
Have a wonderful Memorial Day.
And the same to you. Wonderful
Memorial Day. He's blessed to have a wonderful, caring daughter like you, Mary. Really, you really are. You're a sweetheart, and you're caring, and I can feel it. But I don't think that he needs any more PSAs anyway.
Any more PSAs?
No,
okay.
I think he's good with that. Okay.
Okay, thank you.
Righto. Joe in New Jersey. Good morning. How are you?
Can you hear me?
Yeah, I hear you.
Okay, I just heard the ad right before you for that.
Yeah, I heard the ad. Yeah,
okay, so
I heard that ad. I heard 25,000 ads this week. Okay, every time I'm in the car, because I travel from Westchester to Long Island, I'm in the car, and you know how many ads there are. You know how many companies there are. Scientifically proven testosterone replacement. Call this number right now, and we'll give you a month's free. There's no scientific data that any of that works. Okay, there's no clinical trials, and I will not recommend any of it. Period.
So are they lying when they said they gave this pill to these guys and they woke up with erections in the morning?
Yeah, the one guy that hadn't had an erection in 3 years, and all of a sudden, whoa, he woke up with such a firm erection, and oh my God, he couldn't get out of bed. Oh, please. Come on.
So now
I'm not calling anybody a liar, but I'm calling that nonsense. Okay, that's all I'm saying. All right.
Now I've got erectile dysfunction. I'm 65.
Right.
And I've gone through the Boston Medical thing with the needle.
Yep.
And it worked halfway, and then I stopped because it got to be expensive. The Viagra and the Cialis don't work. When I had my testosterone level checked, it was fine. So now the doctor is recommending, he says, if nothing else works, you might want to try a pump, which is I don't want to do. Because I don't want to stand there and pump something up. So
those pumps, you're talking about a vacuum erection device, is what you're talking about, correct? Where you're going to have to, put a device and hold it over your penis and then kind of pump it, almost like to get air or of course pressure and blood flow into the penis. It's mechanical. It's most of the guys that try it for a month, and then it sits in the closet. It costs about $350, $400. I think it's great for guys that are recovering from surgery, but if that's not you, which doesn't sound like you,
right? I
would want to know why you having. I mean, how old are you? You sound young. How old are you?
65.
65?
Yeah.
So, are you overweight? Do you have high cholesterol? Do you have diabetes? Are you a smoker?
Perfect. I'm in perfect health. My diet is phenomenal. I exercise every day.
Have you had Doppler studies of the penis to check the blood flow?
I don't know. I don't recall having a Doppler study.
Well, I mean, what's the blood flow in the penis? It's all about mechanics. And, why do you not have proper, I don't know why you don't have an erection. Maybe you don't have good blood flow there. It's all about good blood flow and having good nerves. You're not a diabetic. You don't have any spinal cord injury, no neurological conditions. You don't have MS or Parkinson's so I don't know why, if you're in great shape, why the erections aren't. Do you have good desire to have sex?
Well, not since I have this problem. I don't want to go. I don't even want to. Every time I'm with somebody, I don't want to even be embarrassed by not being able to perform. So I cut my desire mentally, just cut my desire off, saying, I'm not even going to attempt this. And so I don't even go out that much because I don't even want to be put into a situation where, nothing's happening here. Let's go to.
Yeah, but Joe, the injection program was working for you. The only reason that you stopped was because of the expense. Is that right?
Well, no, the other thing is because then at one point after I did it, I only got like a 3/4 erection.
Okay, so some patients need higher dose, and some patients need to go back to the doctor and make sure that you're doing it properly. You know,
yeah, this was $600 for one of the vials at one point. That's
well,
a lot
the insurance carriers pay for this, though. You know, I mean, some of the insurance carriers will pay for it.
I'm on Medicare now, and they're not going to pay for that.
Yeah, well, then you could talk to the doctor about maybe getting an implant if you really want to have sex on demand. You know, we do a lot of implants at Winthrop, and it's an hour procedure, and that really does fix your erection problem. You can have a firm erection, and you can be, you know, as hard as you want for as long as you want once you have a properly placed implant, and that, you know, will be covered by insurance and Medicare, believe it or not. Yeah.
Medicare will cover that?
Yeah, they do. They do cover it.
And isn't that like but it's a fake
God
erection.
bless America. What?
It's a fake erection, isn't it?
It's not a fake erection. What do you mean a fake erection? There's no fake erections. I mean, it's an erection when you want an erection. It's called it's a device that isn't in the penis, and when you want to have an erection, there's a little pump, and you pump it, and you're firm when you want to be firm. So it's not fake, and it looks and feels like a normal erection. You have a normal orgasm, and you know, that is something that would require a very thorough discussion between you and an expert in the field that does these implants. Somebody does a lot of implants. And I talked earlier about one of the doctors at Winthrop, Dr. Brett Mellinger, who does these. And we do them for patients that have had after surgery, or patients have had a radiation that they needed, or someone like yourself that has been through the gamut of things, of the pills, the injections, and so forth, and still not happy. I mean, it's something worth looking into. That a vacuum erection device that you mentioned earlier, forget that. It's just not that. You're gonna have to pay $350, $400, and that's not covered by insurance, and for the most part. And I wouldn't do that. I really.
Now you say you do these things?
No, I don't. I personally don't. There's a guy at our hospital. There's an excellent urologist at our hospital at Winthrop that does do them.
Where's your hospital?
The hospital's in Mineola, Long Island. Joe, that's the music. I'm sorry.
Okay, all right,
well, it turned out to be a sex show, didn't it? Or a testosterone replacement show, or a little bit of a rant by me. But I was feeling it. I just wanted to get it out to you. You may disagree with me, but this is my thoughts. This is my feelings. And my feelings is that the one pill is not the answer. And I would stay away from these testosterone replacement types of pills. Anyway, I hope you all had a wonderful day. And make sure that you come to our Men's Health Seminar at the Garden City Hotel. This is Dr. Aaron.